everyone. So today we will be discussing how the drugs are divided based on their intrinsic activity. So basically the drugs are classified into agonist, antagonist, partial agonist and inverse agonist based on their intrinsic activity. So in order to understand this, we need to understand two things. First thing is what is affinity and the second thing is what is intrinsic activity. So affinity is the ability of a drug to bind to a receptors. Now, this affinity it determines the concentration around the receptor to form certain number of drug receptor associations. Okay, so if a drug has got higher affinity, it will have the ability to bind to the receptors and the same number of drug receptor complexes will be formed at a very low concentration. So the low concentration of the drug can be used if it has got a higher affinity. Now mind you, I would like to tell here is that all types of drugs acting via receptors agonist, antagonist, inverse agonist, and partial agonist. They possess some affinity for the receptors. Now, coming to what is intrinsic activity. The intrinsic activity is the capacity to induce a functional change in the receptor and it varies from -1 to 0 to 0 to +1. Okay, so basing on this, they are divided into four types. So here I have plotted the log dose and percentage response. So log dose is plotted in the x-axis and percentage response is plotted in the y-axis. So here as you can see, I have marked there agonist, partial agonist, antagonist and inverse agonist. So let us come to them one by one. So what is an agonist? So agonist will bind to the receptor, bind to receptor and it activates it maximally. That is, the intrinsic activity will be equal to 1. You can see here there is 100% of response. So it is an agonist. This graph may be coming as a spotter in your pharmacology practical examination. So 100% response is by the agonist. It binds to the receptor and activates it maximally. Next is your partial agonist. So partial agonist, it binds with the receptor. That is, it has the affinity, but it has submaximal intrinsic activity. That is, intrinsic activity between 0 to 1. Okay, so it will produce a similar effect in absence of a agonist. Here I will have to speak a few points regarding the partial agonist. So, in absence of agonist, partial agonist, what it does, it produces similar effect as the agonist. But in presence of agonist, it will produce antagonistic effect. It produces antagonistic effect. That, in other words, it means it decreases the effect of pure agonist. So, what are the examples of partial agonist? The examples are pindolol at beta 1 receptors, buspirone at 5-HT1 receptor. Okay, so these are the examples of partial agonist. And what are the examples of agonist? Like adrenaline, histamine on their respective receptors. Okay, now coming to antagonist. So what are these antagonists? These are the drugs that bind to the receptor but produces no effect. Here you can see there is no effect of the drug. This bind to the receptor, produces no effect. That means intrinsic activity is equal to 0 for these kind of drugs. Coming to inverse agonist. They have affinity but intrinsic activity between 0 to -1. Affinity but intrinsic activity between 0 to -1. And what are the examples? DMCM or beta carbolin at benzodiazepines receptor. Okay. Now here I want to mention a point that the receptors which have got a constitutive activation, there only the inverse agonism is manifested. So here we need to know about constitutive activation. Now what is this constitutive activation? This means that the receptors, they are partially active even in the basal state. This may be asked if you are a honors student. Okay. In complete absence of agonist also, the receptors are active. In other words, they are tonically active. Okay. So in these receptors only, there is action of the partial agonists. And we remember the examples of inverse agonist. It is beta carbolinate benzodiazepine receptors. Okay. So quickly revising. So agonists are the ones which bind to the receptors and activate it maximally. That is, it has affinity and intrinsic activity is equal to 1. What are the examples? The examples are adrenaline, histamine at their respective receptors. Partial agonists are the ones which have a affinity but have a submaximal intrinsic activity. That is, intrinsic activity between 0 to 1. And in presence of an agonist, this partial agonist behaves as an antagonist. Antagonists have affinity, that is they bind to the receptor and produces no effect, or they have a intrinsic activity of 0. Inverse agonists are the one which have a affinity but intrinsic activity ranges from 0 to -1. Okay. And what are the examples? Partial agonists, the examples is pindolol at beta 1 receptors. Antagonists, there are variety of examples like your atropine at muscarinic receptors, etc. etc. And inverse agonist, the example is beta carbolin at benzodiazepine receptor. Okay, thank you.